I am a Lutheran pastor, pastor in the Christian tradition, and in particular, I identify as a progressive Christian, a Lutheran in the progressive tradition. So what this means is I celebrate the diversity of religious traditions in the world, but I can only speak from the particularity of my own, and that's what I'm going to do this morning. I also acknowledge that in the United States, Christianity is the default identity in a lot of conversations about religion. It's sort of the norm, it's the assumption in any room. I don't assume everyone in this room is Christian. I don't assume everyone in this room has a practice of public prayer like we just experienced. So when I am inviting us to think about the ways that faith communities do assessment, I may speak of practices that are familiar to a lot of people, but I never assume that what exists in one tradition exists in all traditions, that somehow we're all the same and you just have to find the analog for what I'm doing in your tradition. There are Christian ideas, there are Christian practices that may have useful parallels or that just may not. And so I share my experience as a way of inviting us into maybe a way of thinking, but all of us have to do our own work within our own traditions to identify these resources for ourselves. So I just want to say I'm aware of that, and I'm inviting us all to be aware of that in this conversation. Inviting. And I think that the way when living in a world of plurality and diversity, I think one of the best ways to honor plurality and diversity is to just name your limits and speak from your particularity. So I'm going to try and honor my tradition by talking about what I do know, and I'm going to try and honor other people's traditions by not speaking for them or talking about things I really don't know about. Hopefully there will be time in your small groups as you are working on your projects where you'll be able to uncover your own traditions and your own practices and to speak with your own voice. I want to talk about a faith-based approach to community health assessment using this framework, the 3 listenings. Tradition, the neighbor, and the self. And to begin with, those of us who are working in faith-based contexts often have religious texts to which we refer. They are the voice of our ancestors. They're the voice of our heritage. And they help us assess what's going on around us in a couple different ways. I'm going to think about 3, and I wanted to share a text from my tradition that's one that I use often when I'm trying to do assessment in my community, in Logan Square, or in my congregation, or even in the city or in the world. This text comes from the 25th chapter of the Gospel of Matthew, which is in the New Testament of the Christian Scriptures. This is impossible to read if you're in the back, isn't it?
What chapter again?
It's chapter 25.
All right.
All right? It's verses 31 to 40. I'll read it. When the Son of Man comes in his glory, and all the angels with him, then he will sit on the throne of his glories. All the nations will be gathered before him, and he will separate people one from another as a shepherd separates the sheep from the goats. And he'll put the sheep at his right hand, and the goats at the left. And then the king will say to those at his right hand, "Come, you that are blessed by my Father, inherit the kingdom prepared for you from the foundation of the world. For I was hungry, and you gave me food. I was thirsty, and you gave me something to drink. I was a stranger, and you welcomed me. I was naked, and you gave me clothing. I was sick, and you took care of me. I was in prison, and you visited me." And then the righteous will answer him, "Lord, when was it that we saw you hungry and gave you food, or thirsty and gave you something to drink? And when was it that we saw you a stranger and welcomed you, or naked and gave you clothing? And when was it that we saw you sick or in prison and visited you?" And the king will answer them, "Truly I tell you, just as you did it to one of the least of these who are members of my family, you did it to me." So this is a very particular text from a particular tradition. It may remind people of other texts from other traditions. It may have sort of striking features of it that feel very particular to this story. But I'm going to ask you for just a second to turn to the people at your table who are teammates with you. And I want you to just have a conversation. If you can read this, great. If there's someone at your table who knows this story and can kind of recap it, great. If you want to, if you've got a Bible in your briefcase or on your iPhone, great. It's Matthew 25:31-40. I'm just going to ask you to take 2 minutes for conversation at your table and just brainstorm some ways that a sacred text like this might help you see what's going on around you in your neighborhood, in your city, in your home. Take 2 or 3 minutes and talk about how a text like this might help you see what's going on in your community. Here's a piece of teaching or guidance that happened at a large level. I'll have to read this, and nobody's going to have this on their iPhone. This comes from the 2003 ELCA, that's my denomination, the Evangelical Lutheran Church in America, cool. The social statement called Caring for Health, Our Shared Endeavor. Here's what it says. God creates human beings as whole persons, each one a dynamic unity of body, mind, and spirit. Health concerns the proper functioning and well-being of the whole person. A Christian perspective on health, therefore, shares the concern of the Apostle Paul that our spirit and soul and body be kept sound and blameless, quoting 1 Thessalonians, the 5th chapter. This understanding of human wholeness means that concern for health should attend to the physical, mental, spiritual, and communal dimensions of a person's entire well-being. Health is good for its own sake. It's also good for living abundantly in relationship with God and in loving service to our neighbor. So this is a form of teaching and guidance that in my tradition comes from sort of the body of the entire national church. Now you can see there are little pieces of sacred text in it, but this isn't sacred text. This isn't text that Lutherans get together and read on a weekly basis. This isn't a text that has that kind of value, but it arises from our reflection on our texts, and it starts to say things about what we believe about health. Not everyone belongs to sort of a large connectional tradition. Some people's traditions are very local, very centered in a set of families, a particular religious leader. So I'm going to invite you to just turn for 2 minutes to the people at your table and name, where does the teaching and guidance in your religious community come from? Who, from the local level to the global level, who are the sort of authorized teachers and guides in your traditions? Applies ancient wisdom to contemporary circumstances, makes that bridge for us, helps us understand what to do with a 2,000-year-old text when you're talking about public health in Chicago. And it shapes our identity. Okay, and this gets back to another one of those 3 points of tradition, neighbor, and self. Tradition helps us be selves. The identity we bring as selves to every conversation is interdependent on our tradition. To move on, to talk about the neighbor for a minute, sacred texts and our traditions teach us that our neighbors are known and unknown, are global and local. And I'm going to move kind of quickly through some portions of this because my particular experience is really of working at the local level. So I'm going to say a little bit about how assessment happens in religious communities as it relates to global concerns. But because most of the work that I do is at a much more local level, I want to focus there. So when people in my community get together and say, we understand that part of what it means to be this faith community is that we're not just working in isolation, we're not just kind of a small group of 50 people in Logan Square, Chicago, but we belong to this global community of Christians and Lutherans who are trying to do good things. Assessment work on one level is kind of really easy because there's this whole body of people who are out there kind of involved in the global scene and who are saying, we're working with public health, we're working with denominational bodies, we're working across denominational bodies, here's what we see going on, and so let us sort of give you the rundown. So examples would be right now in my tradition, we have a big malaria initiative. The Evangelical Lutheran Church in America is deeply involved in trying to eradicate malaria. That is not something that the 50 people at St. Luke's and Logan Square are like deeply, deeply informed on. But they know that part of their vocation as people of faith is to be involved in public health concerns that are much larger than they are. So the assessment piece is sort of prefab. There's a problem, it's called malaria. There are some really easy known ways to prevent it, including mosquito nets. The primary problem is money. You live in the US, you've got the money, give it to us, there go the nets. Other examples would be like the One campaign or Bread for the World. So there are some of these are like denominational, some of these are interdenominational, some of these are faith-based, some of them are not faith-based. But there are ways that sort of global assessment about public health gets done and opportunities are provided to people of faith to be involved. So what I say is clergy and lay leaders are listening, in terms of the three listenings, to denominational and or ecumenical faith-based health programs. Unknown and global, the things about which we do not know. Examples I gave here are folks we listen to. We listen to the World Health Organization, we listen to the Centers for Disease Control, we listen to both medical and religious missionaries. And I say denominational and public health leaders are listening to actors in the field, reporting on emerging global health concerns. Now, here I said clergy and lay leaders, here I said denominational and public health because in my experience, very rarely are local faith communities really involved in investigating the unknown global health issues. That's sort of the place where we're least directly connected. But then you come to the known and the local. And if you've not heard of it, I just want to point your attention to this fabulous organization called the Center for Faith and Community Health Transformation, which serves as a local clearinghouse for information about faith and public health concerns and how faith communities can be involved in that. CLOC, some of you are working on childhood obesity. So the Consortium to Lower Obesity in Chicago's Children is a wonderful example of a non-faith-based but local public health resource conversation. In my neighborhood, in Logan Square, we've got the Logan Square Neighborhood Association. They've got a health team that works on making sure that people are signed up for all the benefits to which they're entitled. And so the listening that goes on here at the congregational or the faith, sort of the local community level is clergy and lay leaders listening to local program administrators, public health workers, community activists, and others. And I really mean listening. Like, one of the big parts of my job when I first started pastoring in Logan Square with 12 people was just setting up one-on-ones with people who worked in each of these areas and saying, I'm new, I moved here from Atlanta, I'm new to Chicago, we have a lot of ill people in our community, and rather than seeing that as a deficit, we're going to call that an asset because it means we know something about what it feels like to be sick. And explain to me how the work that you do impacts people who are experiencing illness like our community is. Here's where I want to spend a little bit more time though. The unknown and local. This is actually the area where I think local faith communities have one of the best gifts to offer the conversation. I put an organization that I think does wonderful work in this area, Community Renewal Society, which is over 100 years old in Chicago. Comes out of a Christian faith tradition, but really has focused its efforts on issues of racism and poverty. And they have, as an intentional practice on an annual and semi-annual basis, citywide listening campaigns, where people are trained to go sit down one-on-one with people in their congregation in their neighborhood and have a 45-minute conversation where they just ask, tell me the story that's on your heart. Tell me the story that's in your neighborhood. What's the story I need to take back as we talk about how we're going to make an impact? That kind of listening campaign is exactly the kind of resource, is exactly the kind of resource that faith communities can bring to this work. So clergy and laity engaging in intentional practices of deep listening to community residents and neighborhood service providers. So here's an example. I'm going to make this quick. I got about 10 minutes. In Logan Square, about 4 years ago, as our congregation was getting involved with our missional identity as being involved in public health, we called together every public health provider we could think about in our neighborhood. Domestic violence centers, addiction recovery centers, inpatient, outpatient treatment, 12-step groups, after-school release programs for children, the local clinic, hospital workers. I mean, we just got as many people in the room as we could kind of get on our list in the time frame that we had. We knew it wasn't exhaustive, but we thought, we know that at the citywide level, there are departments of public health. We know that at all these different levels, there are people who are tasked with thinking about the health of a community. We're very, very local. We're just in Logan Square. But one of the things we observe is that a lot of health workers have a very specific mandate. Focus on HIV, focus on runaway homeless and street-dependent youth, focus on cancer prevention. We don't have a specific mandate. We have this global kind of text that says, care for the neighbor. And so we felt like one of the assets that we bring as a faith community is to have that convening function. That was one of the strengths of religious communities. We have that convening function where we can call people together and we can say, we know you're working really, really hard. Where does stuff fall through the cracks? So we created this giant grid, and on sort of like the one axis we had all the demographics. So name all the constituencies in the community. Young, old, people of color, Anglos, recent arrivals, long-term generational people. Like we just did a huge brainstorm, name it all. And then along the other axis, name the services that are available. Shelter for the homeless, feeding programs, day release programs, 12-step groups. And then we said, now come on up to the chart, and if you know for certain that a service is available to a member of any of these communities, put an X there. And we just sort of built this giant net. You could just see it. And where there was no X, there was a hole in the net. And we knew that there was a deficit in our community, that there was a need that needed to be addressed. But it wasn't really it was no one's job to ask that question. It was no one's job to just be in the neighborhood saying, if you're just thinking about Logan Square, where's the hole in the net? That's one of the ways that faith communities bring the tools of listening to the task of assessment. Finally, the self. I hesitate to speak here because I don't know. I don't want to speak for public health, but I know that when you're working in faith communities where basically everybody's a volunteer, and there are very few people getting paid to do the work, one of the most important assessments that has to be done, and this is a piece of asset mapping or capacity assessment, is why would I be doing this work? Why would we be doing this work? And there's so much work to be done. Which work is the work that me or we or our congregation or our synagogue is going to take on? And which work do we say, wonderful work, but no, we're not going to do it? So we recognize that the self is both individual and collective. The self isn't just me, the self is also we. And the self is part of the community. So we're not kind of putting the community under a microscope and we're not a part of it and we're probing and dissecting. I've heard a lot of kind of concern and conversations this morning about research and is research of the community or for the community. In faith-based community health assessment, we hope, if it's being done right, we see ourselves as part of our community. So we're talking about what's happening in our own lives. We are from the community. We're not apart from the community. And because the self is individual, one of the listenings we have to do is in prayer. We had an example of prayer earlier. We pray individually, we pray together, but we're praying, we're listening for the deep wisdom within ourselves that says, I've got something to offer this. I'm watching the children of my neighborhood and I can tell that there's a problem with childhood obesity that wasn't there when I was growing up 20 years ago. I think I've got something to do. I've got something to do with that. Or that thing keeps coming up. I saw that special on HBO about childhood obesity. I'm not the one. I am not being called to that particular struggle right now. But it's really listening for the voice of God and trusting that the divine is speaking to us, saying, you've got a vocation in this area, or let that pass to another. We use tools like time and who in a community has done like a time and talent worksheet or some sort of a assessment in your church about spiritual gifts, right? Okay, so we do that sort of listening, sort of a more systematized listening that helps us figure out what are the tools in the community. Because often you'll have one or two leaders saying, this is a problem in our neighborhood, we've got to tackle this. But they haven't checked out whether or not anyone in the room has interest, whether anyone in the room has skills, and then they either get really frustrated with you or they get really angry with you because they've identified the need and you haven't sort of become the person that they needed to make that happen.
Or the third is that everyone becomes incredibly burnt out in a short period of time.
Right? So the assessment piece that we're doing here is, are we actually the ones to be doing this work? And then one-on-ones. This is like the Community Renewal Society's practice. We did this last summer at St. Luke's. We had a small group of about 6 people. They divided up the entire congregation, and everybody had a one-on-one check-in with another member of the congregation where they were just asked to talk for 45 minutes about, what are you passionate about? What breaks your heart? When you look around the neighborhood, what do you wish somebody would do something about? We got that all back. We tabulated it. We heard some pretty clear themes. We heard some outliers. And it helped us make some decisions as a community about, this is something that's important, but there's not a lot of interest or energy here. We're not going to be the ones to tackle it. On the collective side, you experienced a bit of this when we did Bible study earlier. We listen to ourselves in groups. We might be doing that around a sacred text. We might be doing it around like a book study. Members of my congregation read a book called Take This Bread by Sarah Miles, which is sort of an account of opening a food pantry in San Francisco. And it really sparked their moral imagination around the feeding ministry that we do. We do this with town halls, both inside our communities and out. So inside our congregation, on a regular basis, we get everybody together for some just open dialogue. Here's what we're up to. How are people feeling about it? What are you hearing out in the neighborhood about it? What's the criticism of our work? What's the appreciation of our work? Or more recently, like on Palm Sunday, the Sunday before Easter in the Christian tradition, our congregation got together with other congregations in our neighborhood and we marched to the Logan Square Monument. And we had sort of an open town hall where we talked about the work that faith communities are doing around issues of immigration, healing, housing, and hunger. There's lots of like H's and I's. And then leadership meetings. And this is that collective listening, whether it's a church council or an elders board or the deacons. I mean, whatever it is within a community, when you're setting out to tackle a community health issue, you have to have the leadership on board and you have to listen to their wisdom. Sometimes you'll have 1 or 2 leaders, again, who have a real vision for what has to happen. But if they're not listening to the rest of the leadership and the wisdom that the leadership has to offer about, we're stretched right now, we can't take this on, or you don't know the backstory on this neighborhood, or there are 4 families in this congregation right now who are going through that personally, and before we talk about what's going on outside, we've got to talk about what's going on inside. So you have to be listening to the leadership of your community. The part about listening to ourselves, finally, I think that faith communities can bring to this work is who we imagine ourselves to be and who we imagine our neighbor to be. So I believe that when faith assessment is working at its best, we understand our interventions to serve both insiders in our community and those outside our community, because we are a part of the community. So the 12-step group that we offer in the congregation serves members of the congregation, serves people who are not in the congregation. The food pantry serves members of the congregation, people who are not a part of the congregation. It's not health work that's being done from those who have the resources and answers for those who don't. And because of that, faith-based community health interventions make insiders out of outsiders. The people who experience themselves as those on the outside without the resources or the solutions are brought in to say, you're a part of our community, we see you. You know, our sacred texts, our traditions, our assessment, we see you, and in seeing you, you become a part of the community.